Hello everybody, I'm Namita Thapar, Executive Director of MCure Pharmaceuticals, and today we're going to be talking about epilepsy. 1 in 200 people in our country have epilepsy, and still most of us are not educated about the basics like causes, symptoms, treatment, taboos. So today to talk about epilepsy, we have a lovely doctor, Dr. Jayanti. We have Tanya. And we have Pooja.
Hi.
So first we'll start with you, Dr. Jayanti, to understand the basics about epilepsy.
Epilepsy is really a brain disorder. Ever since we are born, we have electric currents in our brain, and those have to be there. If they stop, you're dead, right?
Correct.
So you have to have currents all the time. But these currents are going around in our brain in a very organized, choreographed fashion. So when for a few seconds this current goes awry and someone has an explosion of extra current in the brain, in lay terms we call it a short circuit for people to understand. So that spark kind of overdoes itself for a few seconds, that manifests externally as a seizure or an epileptic fit.
Okay.
This is what an epileptic seizure is.
And there always has to be a seizure preceding the diagnosis, and is there always a seizure at the time of an epilepsy?
You can have epileptic seizures and it need not be epilepsy.
Okay.
Because any kind of disturbance in the brain, when the baby has very high fever, for example, they have what is called a febrile seizure. But that's not epilepsy. In an older person, if the sodium levels in the body go down for some reason when they are sick, that can cause a seizure. But if these seizures keep happening again and again, without a clear immediate provocation,
right,
then you call it epilepsy, because there is a tendency now in the brain to just keep on having occasional extra currents without major provocations.
Understood.
Only then you call it epilepsy. So 1 in 100 people can have a seizure in their life.
Okay.
But only half of them really will go on to have repeated seizures or epilepsy.
Got it. And then is there a certain age by when? So I've heard of kids having it, teenagers having it, even older people having it. So is there a certain pattern where most of the times these seizures would be found at a certain age group, then leading to diagnosis as epilepsy?
Yeah, again, so see, epilepsy or seizures is only a symptom.
Okay.
So anything that insults the brain, damages the brain, or disturbs the brain's homeostasis, so to speak, can cause a seizure. So it can happen at any age, and the causes are a variety of causes. Anything that can affect the brain's, as I said, for want of a better word, homeostasis, or there's a scar in the brain or something that's left behind, can cause seizure. So you have kids having, at the young age, that's one peak where you see a lot of new patients with epilepsy.
Okay.
And then again in the elderly, you can have people having multiple reasons, because insults to the brain as we get older become more common with strokes and tumors, but there is no age that is kind of escapes the possibility of having a seizure.
So it can happen at any age.
Yes.
And what are the typical causes? Is it genetic?
Again, the variety of causes, and with all these causes, in a random patient, sometimes you don't find a cause. So that also happens. A 30 or 40%, after you do all the tests, you may still not find a cause.
Okay.
But common reasons differ with age.
Okay.
So in the young babies, when they are born, that's a very important condition, because some of these are preventable. So I'm talking about those. So when the baby is being born, if there is not enough oxygen reaching the brain, or if the glucose levels drop because of a badly managed delivery, it can affect the child's brain permanently. And that can lead to seizures lifelong, and can also cause mental subnormality. So that is one. Infections in the brain, like tuberculosis, or there's a worm which we call the common tapeworm.
Yes.
So the tapeworm infection, the larva of the tapeworm can go and sit in the brain.
Oh my God. Okay.
And then it causes a small lesion there, and that can heal, but it may leave a scar and cause seizures. So this is another common condition in the rural areas, especially when hand hygiene is not good. You don't wash your hands well. Then these kind of things sit in your nails, and then you kind of eat the dirty food, and it can cause infections.
My God.
So that is another. So any kind of brain infection.
Right.
Then road traffic accidents, when they injure your head, right? You don't wear a helmet when you're driving, injure your head. That's another big piece that happens in young people.
Right.
And so it's so important to wear head protection gear. And then the other piece is strokes in the brain. because like just as you have heart attacks where the blood flow to the heart stops and you have a heart attack, similarly when it happens in the brain, you call it a brain stroke.
Correct.
So the stroke is one bit, but the stroke may recover, but it may leave a scar and people can have epilepsy after that.
So these are the common causes. And is it genetic?
Then there's a small portion of which the person is otherwise well, no injury in the brain, but just got programmed differently when they were, when the baby was being born. And so those are genetic conditions. So many of those, you don't have anything else wrong with the person, but just around their teenage or around childhood, there are different syndromes, as we call them.
Other than seizure, are there other symptoms which would lead the patients to think that, okay, I could be having epilepsy, I need to get it checked out?
Depending on which part of your brain is sparking abnormally, the symptoms can be very varied. So if it is in a very small area, like which is controlling your hand movement, you may just get a little jerk and that's it.
Okay.
You may be aware of it. Whereas if that spark spreads to the whole brain, then you kind of lose consciousness and then you may shake, you may fall, and you may not be aware. So symptoms are various, which is why diagnosing can be a challenge.
Right.
Because people don't recognize. We all have heard कि वो तो गिर गया, झटके आए, आँख घुमा दिया, ज़बान कट गई. That's a standard tonic-clonic seizure. But there are so many other types.
Right.
People may just lose control, wander around, not be aware, just smack their lips, and then come back, and they're not aware that they had it.
I'd like to cover a last aspect, which is the treatment.
Right.
So once you've discovered or diagnosed that the person has epilepsy, is the medication something to be taken throughout their life? How does it pan out?
Epilepsy is treatable.
Okay.
Yeah, because a lot of people believe nothing can be done about it. So earlier we had some concerns about some medicines, but now all those aspects with a lot of research, doing a lot of focused research to get safe medicines which are effective. It is usually longer periods. It can vary from 2 to 5 or sometimes even longer number of years. Because what these medicines do is that they suppress the tendency to have seizures. They don't remove the tendency. Right? So that is why you need to keep taking medicines for a longer period.
Okay.
A lot of times people can outgrow their epilepsy. It depends on the cause.
Okay.
Which is why you can't give a generic answer ki this is the problem, you need to take it for this long. Your doctor has to monitor you and then make a decision for that person. About 70% of people can do very well with medicines.
Okay.
But yes, there is a 30% where medicines also sometimes don't work. You're taking medicines and still the problem is there. Now science has a lot of choices in terms of treatment.
Okay.
One is to look for an option of surgery in the brain.
Okay.
Because if there is that one spot which is being very resistant and keeping on generating those abnormal currents, we can identify it and go and remove it by a surgery. And the problem can stop. But before we say medicines are not working, the person has to take their medicines very, very regularly. Many people slip up on this.
Yes.
This is one aspect which has to be emphasized to people, that medicines, taking them regularly, having a good sleep patterns, and having a generally a disciplined lifestyle.
Correct. But then what are the misconceptions and why are there so many misconceptions and taboos around epilepsy?
Unfortunately, I think the brain is such a mysterious, organ that most people hadn't understood it for so many years.
Right.
I can't say we have cracked it all, but we have some idea now. So I think over the generations, there have been a lot of these kind of grand ideas about why seizures happen. Because people have seen it, it's a time memorial disease, right? Because you fall and shake and everybody can see it. So there's been so much of wrong information out there and so many attempts to heal it by various kinds of...
I've heard of black magic, kala jadoo kiya, do
now,
something for
that. Even now, people, they don't tell us, but on the side, they do that as well. They take them to a soothsayer or a tantric and... So,
that's a very big myth.
So we need to spread right information. So my belief is that this is still a stigma because there's not enough being said about the truth.
Absolutely. And people are not talking about it.
Yeah.
And speaking of that, we'd like to move on to these fabulous women who've come here to speak about it. Tanya, why don't we start with you first? Tell us about your journey.
About my journey, I was 1.5 years old when I had fallen down from the second floor and I had a major injury on my forehead. I did not show up any symptoms until the 4th grade when I had a major grand mal seizure. and I had passed out, and I was in the hospital for another 1 week, and the doctors told my parents that I have this major grand mal seizure, and it would be kind of difficult to treat. And before 4th grade, I was really a lively kid, and I enjoyed everyone's company and vice versa. But after this seizure, it all just get kind of disrupted. My academic records fell to zero. My confidence shattered because of that. Around 12th grade or so, when my seizures had kind of reduced, the frequency had reduced, and then I was like coming back to normal. My records just shooted up, and then I realized it's just a normal thing, and the only thing stopping you is yourself. It's all in the mind, and then you just have to take care of yourself. So putting that in mind, I was really intrigued about epilepsy and neuroscience, and so I perceived that, and I have a master's in clinical neuroscience.
Oh wow.
I studied that.
So you made it your strength.
Yes.
Are you still on medication?
Yes, I am on medications.
Do you feel you find any side effects of those medications?
Not at all, not at all.
And you've not faced any community or external taboos or labels because of having epilepsy?
Not at all, not at all.
So you've had a positive experience when it comes to just interactions with the community.
The epilepsy was the same, but just her way of looking at it changed.
It's all about how you
and
react
then the world
to it.
opened for her.
Right? So brilliant story, Tanya. Thank you so much for sharing it with us.
Thank you.
And with that, we move to Pooja. Pooja, we've met before.
Yes, we have.
Right? At Shark Tank.
Yes, we have.
And it's just so wonderful
What
to
a
see you back.
coincidence.
What a
Yes.
coincidence.
I mean, I'm thinking, how can this happen?
This is really a coincidence and really meant to be. And I'm so happy we reconnected because I loved interacting with you on Shark Tank.
Thank you.
And it's wonderful that I get an opportunity to do it all over again. But this time for a different reason and on my show. So thank you, Pooja. Please share your story with us.
I was diagnosed with epilepsy when I was 13.
13, okay.
Okay. And I don't know what happened. Suddenly, just one fine day, I just got a seizure. I was never treated differently, Namita. And I think that kind of made a little thing in my heart that I'm not different. Today, if I've got a seizure, in the evening, if you're fine, you can have dinner, you can go to school the next day. Now, when I think back, I think the very fact that my parents didn't overprotect me or underprotect me and just treated me normally made me feel very normal.
That's wonderful. And that's what's lacking in a lot of
So the family,
the ecosystem.
The family is our first ecosystem.
Yes.
And if that can, look at it in a matter of fact way, there is a problem that needs to be attended and not add any other stories around it, negative stories. I
Right.
think that helps. It's not easy, but I
Absolutely.
think that's something they have to be conscious of because many children or many young people do outgrow their seizures.
Correct.
And then what gets left behind is that, hey, don't do this. Hey, that the mom's voice is what often, the
Correct.
parents' voice is
You're
what
limiting them.
rings in your ears all the
Yes,
time.
yes.
So if that is a positive voice, then you're always positive. So I think parents and immediate family
need to play a very important role.
Important
And
role.
Doc, that also explains why she picked up such a taboo topic for Shark Tank as why she's an entrepreneur. Because you have to have a certain personality type
Yes.
to really take up not just entrepreneurial venture, but in a field that is considered a big taboo by all of India and even globally. So I think now I'm getting a lot of insights into why you are who you are.
No, so I'll Namita, my mom is a very, very strong personality.
Yeah.
And I think I just get this from her. And I have got seizures in college, I've got seizures in my MBA college, I've got seizures in my time. So I was working with Times of India for 2 years, then I worked with Z for 15 years. I've got seizures all around the place. And I have hurt myself also very badly. And every time there's a seizure, I hurt my nose and I've got face fractures and multiple things. But next day I'm fine and back to office. And periods was one of my trigger, to be honest, okay. I get seizures. or the probability of seizures going up is there. So
Is that common, doc, for a lot
about
of women?
30 to 35% of women, to give you a number, can have seizures around their periods, but it's not like the exact time. It's just
Okay.
a general.
Yeah, yeah.
It's just a general thing. It doesn't happen every time, but
Okay.
when it
But
happens,
that can
it
be a
may
trigger.
So
Okay.
yeah.
my bosses knew that I have epilepsy, and they would be like, Pooja, 3 दिन office मत आ, चलेगा, but take
See?
care of yourself. And because what also
Amazing.
happens is my ability to deliver doesn't go down because of this.
Correct.
It's like, I would think it's like blood pressure, diabetes. We can't sit and kind of mull over it
And she's gone
Absolutely.
one step ahead with this, and now she's now part of our NGO as well.
What exactly is the name of the NGO, and what do you do, and what was the thinking behind starting this NGO?
Yeah, so this is the Indian Epilepsy Association. So it's a
Okay.
national organization. I must say that doctors who are my, predecessors realized that epilepsy is not only a medical problem, but it's also a social problem. So
Right.
people need support outside of the doctor's clinic. And probably they felt the doctor is the first person who can help that happen. So they set up this, and it was started in Mumbai,
Okay.
but it has branches now all over the country, and it's become a national organization. But
Fantastic.
we, as students of those doctors, have an extra, attachment to
Absolutely.
this cause, and we feel that we need to spread right awareness about it. We need to provide support for patients, emotional support, psychological support, because you were asking about other conditions.
Yes.
So mood issues, feeling alone, anxiety, fear about seizures, these are a lot of psychological things
It's a
that
great
people deal with.
support system that they can provide.
So we
what
are-
is the name of the NGO?
Samman, which is
Samman,
dignity.
which is
Yeah.
dignity, respect.
Yeah.
Pooja, are you married?
Yes. So I
Was
was
that
just going
again
to say
an
that.
issue?
So I met my husband in college, and we got married. And in fact, when we got married, it was discussed that because I'm on medication for so long, there is a possibility I might not be able to conceive. But my husband was totally supportive, and before marriage also we went and met Dr. Mani. I mean, we even told my in-laws that I have this condition, and they were also absolutely okay with it. And now I am married for the last 19 years.
Wow.
And I have a beautiful son who's 12 years old.
Is this fairly common that a lot of women who are on epilepsy medication, A, will have complications from pregnancy, and then B, if they get pregnant or once they get pregnant, then they may have to change their medication, and would that have issues with their treatment cycle?
Just to throw in some numbers again, people who don't have epilepsy, even normal people, if you look at the larger population, about 2% of them can have problems during their pregnancy in terms of how the baby gets formed.
Correct.
Right? When you have epilepsy and you're on medications, that 2% can be anything between 4 to 10%. So I'm just
Okay.
giving you some
In terms of the
perspective.
complications for
to
the,
baby,
child.
to the baby.
Right.
So, but it's not uniform for all medicines. And if you look at it 30 years ago, there were only 4 medicines, and probably 2 of them were likely to cause complications.
Correct.
Now we have 20 medicines.
Okay.
And out of which we have good data on at least about 3 or 4 of them, and they are very safe.
Understood.
So it so happened that Pooja was on a medication that now we know more and more that it's likely to cause trouble. So we consciously gradually switched her to a medicine in advance.
Okay.
You don't do it after you get pregnant. So it has to be planned.
Got it.
Because once you conceive, that's not the time to change medicines. It's risky to do it at that time.
Do they have trouble getting pregnant? Because
A
of
small
the medication?
portion, a small
very
portion,
small.
yes.
So these numbers are statistically insignificant.
Yes,
And so
absolutely.
people should not have this, again, myth or misconception that it'll come in the way of them getting pregnant or delivering a healthy child.
This is the thing. So earlier there was no information available. Now we have everything out there on Google or whatever, but it's not distilled, right?
Got it.
It's all, so there is a lot of fear mongering that happens. Oh, I'm pregnant, now I have to stop my medicine. My medicine will cause problem
Right.
to my baby. It doesn't
Right.
work like that, which has to be personalized.
Absolutely.
So I feel it's always when you get some cues from the media or the net out there, it's better to go and discuss that particular issue with the doctor so that they can personalize that information.
Correct,
So I
correct.
don't want people to feel all the information out there is relevant for them.
Right. And with that, we conclude today's episode. We learned so many important facts about this condition, but most importantly, what we learned from our lovely women is that you can have the most productive, positive, healthy lives. There are really no taboos. Get educated, get more people educated so that we break these myths, break these stigmas, and spread more awareness. Thank you very much.
अपनी उजली ढूंढने है वो निकली तकदीर अपनी उजली इल्ली ने मन में ठाना है बन के उड़ना है तितली दायरे लाग के ही तो जीना आया मुझको मैं बदली